116 total pediatric COVID positive admissions. We have had 131 positive COVID moms. Very proud to say that not one single baby subsequently tested or positive for COVID. So our policy there was working very well. We are currently still in an uptick from the first wave, where we have around 5 or 6 COVID positive moms on a daily basis, and around 5 or 6 pediatric COVID patients that are in a bed at any current time. And we are projecting another bit of an uptick, or if you want to call it the third wave or whatever that might be, in October from the opening of schools, restaurants, football, Labor Day, and then perhaps one again in January. So we are preparing for all of that. We've done a lot of neat things to try to keep the experience still there during these difficult times, because we do allow visitors. We allow one parent at a time in pediatrics. And in NICU, and we do make a lot of exceptions for extenuating or circumstances, and do let parents stay overnight as well. We also allow the birthing or partner here. Our nurses came up with a great idea. We took headshots of everyone, so when they go into the room and they have the mask and the goggles and the hood and they're all dressed, that our children and the parents too can see what you really look like, and it appears to be lesser threatening. The technology that we employed, tablets, iPhones that we pay for the service contracts, Android phones. We have mobile Zoom. We're on Zoom now, but we've created mobile Zoom stations for our NICU. So if moms need to stay home, or if they're COVID positive, they can see their baby at any hour of the day. We created, because of our opening to visitors, we created a group of safety ambassadors that wear vests, and they go around and they educate our visitors how to wear their mask, how to be safe. And they also take those times to teach moms in the NICU that are here and want to hold their baby, just how to ensure that they are safe and keeping their baby safe. And a lot of one-offs. There's too many stories to count, but one example that comes to mind is for Father's Day, we took a special patient from our ICU and were able to take him home to be able to see his dad for Father's Day. So we have really gone above and beyond, which is really neat. Going forward, the challenges is that our volume is down. We used to see 90 patients a day in our emergency room. We're seeing 30. In our urgent care centers, we were seeing 600 pediatric patients a month. We're down to about 150. So our volumes are down, and that's actually a good thing. And from a community health and children's health standpoint, but it affects the hospital and the hospital's subsequent revenue. Once schools open up and things open up a little bit more, that's probably going to change. From a maternity standpoint, our volume's down there, but that's because of our international or program travel or restrictions and things like that. Just some exciting things to report in the end is our growth and our community or outreach plan. Our new hospital in Doral is set to open up in March, and we're going to have a pediatric specialty presence there, as well as the ability to do diagnostics at the hospital. And we're also implementing that same plan at Jackson South and Jackson North. As we know, in Miami, on a map, it might look like it's 3 or 5 miles away, but it can take you 45 minutes to get there. So we really want to put our talented specialists in the field so all of the community can access them. We just hired a new internationally known pediatric open heart surgeon. He starts on September 14th, and we're recruiting an additional one as well. And we also have a very aggressive strategic plan for fetal surgery that's actually doing surgical procedures on the embryo, on the baby in utero. And we also, for our maternal fetal medicine and high-risk OB, the same thing that we're doing with the pediatric subspecialties, we're doing with those as well. And really, that's us in a nutshell, and kind of where we're going. I just have to reiterate what an honor it has been to work with all these amazing healthcare professionals. You have a few of them here today, and Dr. Ofir, Dr. Shatany, and Dr. Gwynn. So I know that you'll enjoy what they have to say as well. And I'm happy to take any questions if you have them.
Does anyone have any questions for Hamilton? We'll have an opportunity to ask questions at the end as well. And again, you can either use the chat feature or you can raise your hand, and then we will unmute you and you can ask the question.
Thank you very much.
Great, thank you, Hamilton. Our next speaker is the Associate Professor of Pediatrics at the University of Miami, Dr. Audrey Ofir, also Director of Pediatric Comprehensive Care Clinic and Director of the Pediatric Residency Continuity Clinic. That's a mouthful, Dr. Ofir.
Good morning, everyone. Thank you so much for having us. First of all, I just wanted to be able to just talk about children's health in general in the middle of this pandemic, and starting out by saying that children's health is not just about COVID right now. I think it's important to say. We have seen the rate of children's immunization throughout COVID, unfortunately, go down to 70% in Florida. This is definitely not the direction that we wanted to see for our immunization rate. So it is important now more than ever to make that call to the pediatrician's office and check whether our children are up to date on vaccine. The last thing that we want right now is an outbreak of measles or pertussis. So please make that call and make sure that your child is up to date on the vaccination. And then flu season is right around the corner. And very frankly, we really do not know what would happen if a child would have an infection of influenza at the same time as COVID. So this year, more than ever, it's going to be very important for everybody, not just children, to receive their flu shot. So that's another reason. But going to the pediatrician is not all about vaccine. We all know that. It's also to be able to check on the growth of children, to be able to make sure that they're developing okay, that they're up to date on their development. I think that pediatrician everywhere, including us right here at Holtz, we have gone above and beyond to make sure that children and their families are safe when they come to see us. So I think that first and foremost for the children's health, go ahead and call up the pediatrician, make that appointment, and catch up on the well child care visit. But then the other thing I think for parents to think about is getting back for the children on some kind of routine. I think that no one will argue that with this semi-isolation, semi-confinement, the routine of children has really very severely been disturbed. And to start off with bedtime routine, I have some of my teenage patients who are telling me that they're going to bed at 2 and 3 o'clock in the morning, not waking up until after 2 o'clock in the afternoon. And I think that whether these children are going to go back to virtual or in-class learning, parents want to think about getting back or getting them back to some kind of a healthier sleeping routine. So how to do that? Probably a way to do it would be by increment. Getting them back to going to bed, let's say an hour earlier than what they're doing right now, and waking them up an hour earlier, and being consistent every single day, including the weekend. And then the week after, getting them up 1 hour earlier, putting them to sleep an hour earlier, until they're getting into a schedule that makes sense for their age. But then also what they're doing at bedtime is important. So for example, an earlier dinner time with something light, not something heavy to eat. Absolutely no electronics at bedtime. It's very important to have in their bedroom no strong lighting, to make sure that their temperature is comfortable. So all of that is very important for them to have a healthy bedtime routine and to have the right amount of hours to sleep. And this is part of being able to focus the next day for them to be able to have a good learning experience. And then by the same token, if you want them to be able to be energized, you want to give them a healthy breakfast. So something to give them a good boost of energy, perhaps a combination of healthy protein with fiber and a good amount of maybe a yogurt with berries and nuts to give them a boost. You want to give them, if possible, a space in the home where it's going to be away from noise and away from distraction. It is extremely important for them to have regular breaks from the screen, if possible, outdoor. So we know for a fact that having long hours on the screen can bring some health issues. So the parents have to be aware of that. There is actually something called computer vision syndrome. It has a list of symptoms, including headaches, dry eyes, blurry vision, neck pain, shoulder pain, and more. Of course, certainly if the children show any kind of symptoms such as those, I would encourage the parents to make an eye doctor appointment to have a complete vision check. But more importantly, probably to prevent that. So there's the rule of 20, what is called. So every 20 minutes, to have the child for 20 seconds look away from the screen and try to focus on an object that is 20 feet away. So every 20 minutes for 20 seconds to have the child look away at something that is 20 feet away. So again, we talked about the bedtime routine. We talked about a healthy breakfast, looking at the screen with breaks, healthy break, outdoor. But also what is important probably is to be able to make some kind of transition when and if there's going to be a transition to in-class schooling. And for that, the parents want to have the talk with their children about how different schooling is going to be this year. First of all, the classroom layout is going to be different. The desks are going to be distanced. The teacher probably will not be able to be close to the students, so you want to talk to your child about that. The parents should have some kind of morning routine, prepare the backpack. So perhaps to have a little sandwich bag with the name of their child on it, because the child may have to take out their mask for example, like lunch when they're going to have to eat. To have a spare mask in the backpack would be a good idea, also labeled with their name on it. I would advise to have an individual sanitizer bottle in there for their own use. If they can, perhaps a small water bottle in the backpack, because it's very drying to breathe through a mask, dry for the mouth and dry for the throat. So if the school permits, that would be a good idea. And then talk to the children about what we call nowadays the 3 W's. So wearing the mask, watching their distance, and washing their hands frequently. And then to have an after-school routine. So washing their hands thoroughly when they come home, and then taking a bath or a shower right after school, and then washing their clothes and washing their mask on a daily routine. So certainly there's a lot to think about for the parents, a lot of COVID parenting, very difficult, but not easy for sure, but necessary at this point.
Thank you so much, Dr. Ofir. That was so helpful. Do we have any questions for the doctor? So I have gotten a question based on what you said earlier, and I'll share that now because I think you may have touched upon it. But so what to do with your child's belongings? So specifically their backpacks, which have all of their items in there. Should you do something with that when the kids get home? So we heard you say about the mask and then, being washed, but what do we do with backpacks and all their supplies inside?
So I think like for any contact surfaces, we would recommend sanitizing. The child is not going to remember, and we're not going to know, we're not going to be able to control what came into contact with that backpack. So I think that the common sense to do would be to just go ahead and sanitize the backpack and just go ahead and take out what was in there, sanitize what you can. And again, whether it's the mask or the clothes that they wore that day, to just go ahead and wash it on a daily basis.
Thank you. Excellent. So next, let me introduce Dr. Brandon Shatany. He is Assistant Professor of the Department of Pediatrics, Division of Pediatric Infectious Diseases, and Associate Program Director of the Pediatric Infectious Disease Fellowship. Dr. Shatany?
Hi, good morning. Thank you for having me. It's important that everybody is aware of like where I'm coming from. Yes, I'm an infectious disease specialist. I'm also a father of two young children, 4 and 8. You know that I'm also there with you in the struggle of what is happening with school and what we're going to do right now. So I'm just going to give some safety points that we can keep our kids safer when they're going to school and coming back home and in preparation for that. Looking at what the CDC says, the Center of Disease Control, they really remark on those barriers, as many mitigating barriers that we can install so that children do not come in contact with the virus, we reduce their risk. Primary transmission happens most commonly with children from other adults. And so we're focused on the teacher wearing a mask. So asking your school, are you requiring all of your teachers to wear masks? Are you requiring all sanitary staff to wear a mask? Every adult that they necessarily come in contact with should be wearing a mask and having that regular hand washing. Dr. Ofir was absolutely right with doing the education of our children before going back to school and following those 3 W's so that they themselves can be their own advocates and keeping themselves safe when they're at school. Of course, recognizing that that will depend on their age. So having the age appropriate learning and education of your child will be the best way, a best approach to get them to follow those rules. So for younger children, you really want we're going to give you another set of 3s, the 3 P's of being patient with them. I have a 4-year-old. Patience is very important. Practice regularly. And the last one is positive reinforcement. You know, mask is not something that a lot of these children are used to. And so having a mask on, being comfortable with the mask, try different materials, try to get a situation where they're most comfortable to sit for extended periods of time with a mask on. If your child has certain conditions, a mask may not be available to them. If they're especially young, especially if they're younger than 2 years old, and some say younger than 4 years old, if they have breathing conditions that do not permit them from wearing the mask, then you have to look at alternatives and what is still safe. There are studies that compare the different barriers that can be put in place in terms of personal protective equipment. Mask is absolutely the safest, but then next to that, if you're just wearing the face shield that goes all the way down below the chin, that is another barrier that can be there, especially if a mask is not available to the child, that is a little bit more comfortable, but still gives them a good level of protection. If we delve into percentages, the mask, if the teacher is wearing a mask, even if they have COVID, their ability to transmit COVID is reduced by 90%, which is a good chunk. Then if the recipient, your child, is wearing a mask, that reduces it further by 30%. Now, when comparing between a shield, a face shield, or a mask, you're getting anywhere between 20 to 30% reduction. After that, the other mitigating ways of doing it aren't so good. Just social distancing alone does give you a good 10% reduction if there's no protection whatsoever. But again, as you combine these things, you see that that's the safest way to keep our children safe. I'm going to touch on sports and in physical activities. It's all about the contact and how close they're coming to one another. So football is going to be kind of difficult, especially if there's any touching and which is like the basis of football, right? So that's going to be a very difficult sport and I would not recommend it at this current time, especially when community spread is above that 5% level. It's currently 13%. I just looked at the Florida Department of Health for all of Florida, and the American Academy of Pediatrics is currently recommending really for it to be less than 5% before engaging in some of those high touch contact sports. But if the sports and the way that they're playing the game does not require close contact or touching of a shared object, then it can be pretty safe for them to to be involved. And we can certainly go through some of those questions as we present forward. Other things. So some last things to just reinforce about washing hands and making sure that the time is there. The time is spent washing the hands appropriately. And I teach my kids their ABCs, and they sing their ABCs. I think that an adolescent may not appreciate singing their ABCs. So just make it appropriate for them for whatever song that they want to sing for that time, and that they can make sure that they spend the good time actually washing their hands. Outside of that, the social distancing is the last key, and making sure to maintain those 6 feet. If you're unable to maintain those 6 feet, to make sure the personal protective equipment is on, secured, covering nose and mouth to best protect them from acquiring the virus.
Dr. Shatany, we did have one question. How concerned should someone be that lives in a multi-generational household if kids are going back to school and they're living with grandparents and parents in the home, of the kids coming back into the home and maybe spreading the virus?
It definitely is a concern. Now, that being said, what level of concern is it? From the research that we've seen from Denmark to China to even New York, we see that the spread from children to older adults is very low. That is age specific, however, and it's for children the studies focused on children less than 10 years old. For children older than 10 into your adolescent young adults, they still transmit the same way that adults transmit the virus. So they still have that risk that's there. But luckily with kids older than 10, you can build in a very good routine. So when I go home, I have a very rigorous routine that I go through because I see however many COVID patients of the day every day, and I don't want to pass it on to my kids. And so I make sure that from door to bathroom, I have the most direct route, that the shoes that I'm wearing stay there by the door or in a place that they will not come in contact with, that I immediately wash hands, degown, and have a fresh pair of clothes. I shower, and then I am able to exit the shower with being decontaminated from whatever the outside brought. And I think that that's a regular practice that we bring in. And I think our kids can also partake in that to allow them to decontaminate from whatever they came in contact with outside of the home.
Thank you. Are there any other questions for Dr. Shatany? Remember, you can raise your hand or use the chat feature. All right. Thank you so much, Dr. Shatany. We appreciate that.
I think there was a question.
Oh, there is a question?
Yeah, I had a question.
Okay.
My son has recently resumed basketball practice after school, small group, outdoors, kind of not put together. Is that okay if he has his own ball?
Yes, it depends on how they're playing, because I recognize that basketball, if he has his own ball and he's just practicing the drills and the shots without necessarily like passing the ball back and forth and multiple touch contacts happening there, then that can be a safe practice. Outside in the open air, it does reduce like how easily it can be transmitted, because you have flow of air that allows the virus to go elsewhere and not as laminar, not as directly in each other's face. So that can be safer than other practices, I would say, especially in small groups. But I would stay on top of that. I would make sure that my coach has a very strong, stringent protocol that if someone has any illness, any fever, cough, cold, runny nose, that they cannot be participating in sports right now. And that
They're doing temperature checks before they allow them on the court.
I'm sorry, I couldn't catch it.
They're doing temperature checks before they allow them on the court.
Very good. I think that's a good screening protocol that will allow them to immediately mitigate. It's another mitigation barrier. Like I said, every mitigation barrier that's put in place, we see our kids can be safer and safer. So I think that's a good strategy that they're using there.
I have another question that came in through the chat. Go ahead, someone wanted to ask one?
Yes, it was the same in the chat.
Okay.
What are the medical consequences of wearing a mask for the long period? Because at school, they need to be wearing a mask.
Yes, it's an excellent question and important point to bring up. They've done studies looking at children older than 1 year old that had to wear a mask for over an hour, and they had a pulse ox placed on them, looking to see if their oxygen saturation went below what we deem as normal for the age group, and it never did. Physical activity can be strenuous because you're breathing a little bit harder. There are no long-term effects. You may have some dizziness that's there if they're rebreathing the same air over and over again. So generally with physical activity, you try and do a physical activity that you're safe and you can not have to wear the mask, because that can be very difficult for a child to endure. But otherwise, no long-term sequelae that I've read about through the literature.
Okay, thank you.
Mm-hmm.
Thank you so much. Our next speaker is Dr. Lisa Gwynn, and she's the Associate Professor of Clinical Pediatrics and Public Health Sciences, Director of the Pediatric Mobile Clinic, and Dr. John T. McDonald Foundation School Health Initiative, the University of Miami Miller School of Medicine, and Vice President of the Florida chapter of the American Academy of Pediatrics. Dr. Gwynn, welcome.
Thank you, Flavia. Thank you, everyone. So I'm going to just kind of switch gears. Dr. Shatany and Dr. Ofir did an amazing job at some of the basics for getting kids back into school. I just want to share my perspective of the services that we've been offering out in the community and how parents can kind of tap into some of those resources. So as you mentioned, I'm the medical director for the Pediatric Mobile Clinic, and our unit is, we actually have 2 units. There are 40-foot buses that go out into the community and provide comprehensive healthcare services to children in need. Since the pandemic, we've kind of switched gears, and thankfully we've had some donor support step forward and support from the Department of Health to transition to COVID testing for children. We worked very hard in the beginning of this pandemic to set this program up, because we knew that someday, even though in the beginning the resources were limited and we were focusing on adults, we learned that children, in fact, were impacted by the virus in different ways, but we knew that at some point children would need to be tested. And so we were able to partner with the Department of Health, and since July, we've tested over 6,000 children throughout the community. And we will continue to do so throughout the pandemic. And what we found in testing children is that, number one, the positivity rate is pretty much in alignment with the community positivity rates. And that's basically between the ages of infancy all the way to 18. Another interesting finding that we've seen is that 80% of these children are asymptomatic. And most of the kids that are coming in to be tested, they're being tested because their parents have tested positive. And so that goes in alignment with what Dr. Shatany said about children, that it's usually the parents that are giving the virus to kids. So that is very much consistent with what we're seeing out in the community. One of the challenges that we're facing is that pediatricians still don't have complete access to COVID testing. And so that poses a problem for access for children to be able to get tested. So I want to assure everyone that we are going to continue to offer community-based testing, so that should your child need to be tested and your pediatrician can't do so, that will be accessible to all residents in Miami-Dade County. Of course, we're only one unit. We can test up to 400 kids a day, and we're scattered throughout Miami-Dade County, depending on the day. But that is going to be made available. And so the other piece to this that I wanted to share is that we at the Dr. John T. McDonald Foundation School Health Initiative have 9 school-based clinics in Miami-Dade County, which serve over 10,000 students. And so I've been very intimately involved in the discussions and the planning for reopening of schools, including serving on the superintendent's advisory committee. And so I have to be honest, everything still isn't completely worked out within the school setting. They are, the districts across the state and across the country are struggling with, number one, not having the appropriate resources to be able to provide the safest environment for children. I say this to you all because I can't emphasize enough that we have to protect our children. We have to take charge and make sure that they are following all of the mitigation strategies that we have mentioned. Wearing a mask, making sure that we keep our physical distancing. All of that is extremely important to reinforce to our children because we cannot rely on the school districts to be able to do all of that for us. So it's almost like this pandemic has created an environment that we all have to help each other and we all have to do our part. Now we're getting into the specifics of how to deal with a child that may have symptoms in the classroom. And so we are all struggling with understanding what those symptoms really are. So headache is something that's probably one of the most common things we see in school clinics. And the teachers just will send the child right to the clinic. Unfortunately, we are going to have to limit the traffic that goes into school clinics. And so what does that mean for us in the class, us parents that have children in the classroom? What we have to do is ensure that there's communication with our teachers. If your child needs to have frequent snacks because they're on medication, that needs to be communicated so that some of these things that may be simple that can be solved within the classroom setting to where the child doesn't have to go into the clinic. We want to do as much as we can to mitigate having an unnecessary cascade, if you will, that could lead to your child being removed from school and having to be quarantined at home for 10 days. So we're in those struggles right now in planning our protocols with how to deal with children in the classroom in the clinics that come in with symptoms. They have to be placed in an isolation room. So there's a lot of steps that are going to be involved with managing children that have symptoms. We want to keep kids in the classroom. At the end of the day, we want to increase, to have as much instruction time as possible. That's kind of what we're struggling with in the school health side. We will be ready, and including sanitation protocols and mitigation strategies within the classroom, as was mentioned, with spacing of desks. I have to say, as a pediatrician, I'm most concerned about the adolescent population. I think children from 10 years of age and under, who especially live in multi-generational households, which I fall under that category. I'm not so concerned about the younger children. I'm most concerned about the adolescents. They have this mentality that it's not going to happen to them, and they just don't have that executive function. Just biologically, they don't. And so my recommendation in multi-generational families is to do the best that you can within the home to maintain distancing. And Dr. Birx made this statement a couple of weeks ago. It may come to a point where we have to wear masks in the home to protect our vulnerable family members. And so again, that's something, just because the child walks into the door, that doesn't mean that we shouldn't continue to follow some of these recommendations inside our own homes to be safe. And one more thing that was mentioned about sanitation of backpacks and things like that, we're in the middle of a pandemic and we're all learning as we go, and we all have to be patient. We don't have all the answers as healthcare professionals and public health professionals. So, as these things come up, it's important to maintain you know, not so much a relationship, but you need to have communication with your pediatrician. You need to make sure that your child has been seen for a well visit, so that if something happens, you're not frantic and you haven't been in touch with your medical home. So we as pediatricians always encourage every child to make sure they maintain their immunizations, you know, that their children are up to date with their vaccines, as Dr. Ofir mentioned. One of the other services that we are providing in the community with our mobile units is immunization drives. We are currently in different locations throughout the county, providing vaccines to children that don't have access. As was mentioned with Hamilton, he said that there is a decrease in volume. Pediatricians are also seeing a decrease in volumes. For whatever reason, their parents are you know, hesitant to come into their child's pediatrician. I want to assure you that pediatricians have measures in place, infection control measures in place to ensure that their patients are safe and their staff are safe. So I second what Dr. Ofir said, that it's extremely important to get back into your doctor to make sure that your child has everything that they need to be able to go back to school and to lead a healthy life.
Dr. Gwen, there was a question in the chat, and I know that the CDC has made some changes to recommendations on testing. The question is, what are the current recommendations for testing for children that have had a positive exposure?
So the CDC had recommendations a little, I don't know, maybe 5 or 6 days ago that it wasn't necessary. They changed direction. Unfortunately, this pandemic, a lot of these things are politicized, and I can't stress enough the importance of listening to the medical community and science. We still, as public health professionals, feel strongly that access to testing is key. And it's going to be even more so when children go back to school. And what was mentioned about a third wave, we're going to see that. So we're preparing we continue to work with the Department of Health to be able to provide testing for children. So unfortunately, our CDC is going back and forth. But I can tell you with confidence that the best thing is to have access, for children to have access to testing, and we will continue to advocate for that.
And the next question is, with regards to children, it says most have no symptoms, but are there any symptoms for children from the virus that we need to watch for and worry about? Specifically to kids, and I know that there's been a lot about what kids that have been affected that were positive for COVID and then were on the news that later developed another type of illness.
Well, I think Dr. Shatany can speak to the inflammatory condition. Also, our cardiology colleagues are telling us that we're seeing effects, viral effects on the heart. And so we're learning, as I mentioned, we're learning as we go. But for the most part, from the general symptomatology, it's just like everything else. So what we're probably, in an ideal world, if the child comes into the office and has fever, sore throat, and headache, they're going to get a swab for COVID, they're going to get a swab for strep, and perhaps a swab for influenza. You know, that's kind of the trifecta for us in terms of understanding what's going on with the child. There is very few children have the loss of taste and smell, but Dr. Shatany should speak on the inflammatory condition, because that is a very serious thing that we have to be aware of and looking out for.
Right, so that post-inflammatory syndrome is something that's caused in how children's immune system reacts to having been exposed to the virus. So you and I, adults, we produce antibodies that should protect us from the virus, but children, they don't have the full maturity in their immune system to produce the antibody in the most appropriate way. And so what happens sometimes is that they produce an antibody that, in fact, revs up everything in their body, and makes their body think that it's really seriously infected, which can cause harm to their own body. So it's kind of like an autoimmune disorder, and that it's attacking itself and just trying to protect itself from something that's not really there, not actively infecting them. You'll hear the name MISC, which is a multi-system inflammatory syndrome in children. It looks a lot like another syndrome that you'll hear in the news called Kawasaki's disease, which involves inflammation, can involve inflammation of the heart, can involve neurologic symptoms where they feel disoriented and dizzy. But the primary symptoms, to answer the question, the primary symptoms that you'll be looking out for, what we see earliest with these children, is fever greater than 3 days. So not fever on the first day, fever that's been persisting for more than 3 days, and having abdominal pain. Seems to be the two primary symptoms that we've been seeing in the majority of children that have turned out to have this condition. I've been consulted on a great deal of MISC, and so I've kind of gotten to see the spectrum of how this disorder presents, and they all have fever and abdominal pain to start with. It's that fever that lasts for more than 3 days, and then they need to come into the hospital to get evaluated to see how serious it is.
Thank you, Dr. Shatany. Dr. Gwen, a question is relating to the mobile clinics and the testing, is if your pediatrician doesn't offer the COVID test and you need to access one of these community resources, how does one know where the mobile clinic is going to be, and do they need to schedule an appointment or?
Yes, so the answer is yes. It is open to any child that needs to be tested. It is free of charge, and it doesn't matter where where you're referred from. It's available to all children. We do have a flyer. I don't know if maybe we can distribute that.
Absolutely.
And as a matter of fact, the demand was so great, we had to invest in a new call center. Our phone lines just couldn't handle the demand. So yesterday we went live with our call center to ensure that calls weren't dropped and that patients were able to be connected. The demand was just overwhelming. So we are building up our infrastructure to prepare for the higher volumes once kids go back to school in person. So we also accept walk-ins. So, but the best advice is to call that number, and they will instruct you. Usually we can get you in the next day, or if you can show up as a walk-in if we're not completely booked. So we'll share that number with you. We also have immunization drives. So if children need to get their vaccines to get them up to date to go to school, we also offer that service as well.
Excellent, thank you. Do we have any other questions for any of our speakers? This is a good time to ask anything we may have missed. Check our chat here and make sure that we went through all of the questions that we had here. Here we go, this question. In terms of setting, is there a criteria that you're using to determine who should be seen in the office, telemedicine, or who should be sent to the ED? That's what's written on the question. I don't know, Tatiana, if you want to add a little bit more to that.
So I can take that question if you want. The screening over the phone, it's really important, and it's part of the safety measures that we have in our clinic, as a matter of fact. So we actually screen over the phone the whole household of whether anybody at home has had any of the long list of symptoms of COVID. Of course, the patient, him or herself, and then any direct exposure of any of the household members, and whether anybody has been tested and what the results were. So depending on the answer to all of these questions, we determine whether there is a risk of that person to be what we call under investigation or a PUI. And if that's the case, then we decide on doing a telehealth session. You can actually get a pretty good idea by doing an audio-visual session. And then from there, we can decide whether the child needs to be seen in the emergency room or not. Of course, if there is any respiratory symptom, especially with shortness of breath or any distress, we will advise the parents to go straight to the emergency room.
Thank you. I think we've gotten all the questions that were in the chat. So I want to take this opportunity to thank our guest speakers for all the wealth of information. We are going to record this session and we will share it with some of our other donors. And as a follow-up, we will also share the flyer and the information that Dr. Gwynn mentioned about the testing and the immunization drives as well. Thank you so much for all that you and your teams have been doing during these trying many months. I think it's 6 months now. And I know that we still have a ways to go. So we are grateful, all of us at the foundation, for everything that you're doing. Our donors are grateful. The community is grateful. So thank you. And to our friends and supporters that joined us, thank you as well. We hope you found this session to provide you with the information to be useful and have a safe kind of return for your kids back to school, whether it be virtual or in home, as we continue to adjust to this new normal, which is not a word many of us like to hear, but it just continues to be what we need to do in order to move forward. So thank you all. Have a great afternoon and a great weekend, because it is Friday. I almost forgot about that. So enjoy. Thank you so much.
Thank you.
Be safe.
Thank you.
Take care.
Bye-bye.